Okay, let's see if we ever do time to do a quick video on ABGs, or arterial blood gases. So arterial blood, so instead of a venous blood draw, we're getting an arterial blood draw, usually from the radial artery. There is a VBG, you can get a venous blood gas as well. We want to know what the gas is, oxygen, carbon dioxide. We want to know what the oxygenated blood, or their arterial blood, their oxygen and carbon dioxide content, okay? And this is also going to help us figure out our acid-base balance in the body, okay? So quick side note, so if you're going to draw an ABG, usually it's a respiratory therapist, physician, depends on where you're working. You do a quick test called an Allen's test. So what is that test? You have the patient squeeze their palm and squeeze all the blood out of their palm, okay? And then you occlude the radial and ulnar arteries, and you open the hand. And you can see the hand, it looks ischemic, right? There's no blood to come in the hand. So then we let go of the ulnar artery, and you can see the palm, the skin of the palm reperfuse. That means the ulnar artery is patent, okay? Why do we want to do that? Because if we're going to stick a needle in the radial artery, and let's say it gets damaged, it clots off, then we have no blood flow through the ulnar artery, and no blood flow through the radial artery, and we have no blood flow to the hand. That's a problem, okay? So again, Allen's test, we squeeze all the blood out of the hand, so this is easier to do on a patient than yourself. Occlude the radial and ulnar arteries, open the hand, okay? There's no blood in the hand. You let go of the ulnar artery, it reperfuses, the ulnar artery is patent. Go ahead and stick a needle in the radial artery, and you're good to go. Okay, so what values are you getting on an ABG? So we're looking at pH, okay? PaCO2, our bicarbonate, so HCO3 negative. We're going to look at our PaO2, or oxygen content, and our O2 saturation, okay? So O2 saturation. So our pH, right? So we know our acid-base balance. Normal pH range is 7.35 to 7.45. Gotta know that forever, okay? PaCO2, so 35 to 45 millimeters of mercury. So it's a partial pressure of carbon dioxide. So it's the units are millimeters of mercury. So bicarb, so 22 to 26. The units here are milli equivalents per liter. The PaO2, so the oxygen, is going to be 80 to 100 millimeters of mercury. So it's the oxygen content of arterial blood. And then O2 saturation should be, well, technically as close to 100% as possible. So we'll say 98 to 100%. Some things might say 95 to 100%, whatever you read, whatever. So this is your O2 saturation. So how much hemoglobin on the red blood cells is saturated with oxygen. So that's just like getting a pulse oximetry reading on someone's finger. Same idea, okay? So we're talking about acid-base balance and figuring out our ABGs, right? If we have a acidosis or an alkalosis, is there respiratory or metabolic? Is there compensation? So is oxygenation of the blood important? Well, yeah, it's really important. Does it affect acid-base balance? In this instance, no. So we're not going to be looking at these two numbers right now, because all I'm doing is teaching you how to do ABG problems, right? Calculate your acid base. A very basic way. Okay, we're not going to go into anion gap and non-anion gap, acidosis and all that. So these are values, the three values you need to memorize. You need to know these. Okay, so how are we going to do this? So there's things like tic-tac-toe and Rome and all these little tricks to do it. If that works for you, you can do it. I've never done it that way, so try this method out and see if it works. I've had success with students with it so far. So we're going to draw a chart out. This is what the chart's going to look like. Okay, we're going to make 3 arrows. Okay, pointing up and down. So each of these arrows is going to represent one of our 3 lab values. So the first one's going to be pH. We know pH, okay, the range is 7.35 to 7.45. So next one, CO2, so our carbon dioxide, and the last one is our HCO3 negative or bicarb. So this one gets a little tricky. So bicarb, the low end is 22, the high end is 26. Now the CO2 is the tough part. So the CO2, what we're going to do is we're going to flip this. So instead of putting 35 on the low end and 45 on the high end, we're going to invert it. So we're going to do 35 here and 45 here. Now, why are we going to do that? I'm going to explain it right now. So the top end, so anything above 7.45 is alkalotic. Anything above 26 for the bicarb is also alkalotic. But for CO2, any CO2 lower than 35 is alkalotic. So that's why I put it on this side. Everything here above or below these lab values is considered alkalotic. Okay, so this is alkalotic. Okay, everything below here, so a pH less than 7.35, a CO2 greater than 45, a bicarb less than 22 is all going to represent acidosis. So these are acidotic. Okay, and then we know CO2, so CO2 is representing a respiratory pathway, so we'll put respiratory here, so this is respiratory. So this is respiratory, and this is metabolic. Right. Okay, so this is your chart. You can map this out for every ABG you do until you get good enough at it where you won't have to do this anymore. Okay, so let's do a practice problem. Okay, so you're given 3 values. Okay, let's say your pH. Okay, so your pH, let's say it's 7.3. Let's say your CO2 is 52. And your bicarb, HCO3 negative, your bicarb is 24. So what we're going to do is we're going to map these values out on our chart. So your pH is 7.3. Well, where is that going to be? Less than 7.35. So we write it down here. So that's acidotic. CO2 52. Well, that's down here because it's greater than 45. And we're 35 to 45, so it's high, 52. And then our bicarb of 24 is going to be here right in the middle. Okay. So the first thing we look at is the pH. Well, obviously the pH is on the acidotic side. We know a pH less than 7.35 is acidosis. I'll make another video about metabolic and respiratory acidosis and alkalosis and the causes and all that. Okay, this is just for the ABGs. I'm trying to make it small. So it's acidosis. So CO2, we know high CO2, so greater than 45, is acidotic. So CO2 is buffered and we're more acid. Okay, it's going to represent acidosis. What about bicarb of 24? It's normal. Okay, so we know we have an acidosis. That's number 1. Number 2, is this respiratory or metabolic? Well, let's look at our numbers. In a respiratory pathway, would a high CO2 cause an acidosis? Yes. Okay, so there could be respiratory acidosis. Is our bicarb acidotic? No. So it's normal. So we have a respiratory acidosis. Okay, we won't get into compensation yet. But we'll get there. So we'll do another example. Let's get some new numbers. Okay, so let's say our pH is 7.5. Okay, let's say our CO2 is 36. And let's say our bicarb is 40. Okay, let's map this out. So pH is 7.5. Well, that's going to be up here, which is going to represent alkalosis. So we have an alkalosis. The pH dictates whether we have an acidosis, an alkalosis, or it's normal. CO2 of 36, where's that going to go? Right here. It's going to fall within the range, so it's normal. And then our bicarb is 40. So that's going to be way up here. Okay. And remember, it doesn't necessarily matter how far out of range the CO2 and bicarb are. Okay. That isn't as important. Okay. Just that they're out of range and in which direction. So, same thing. We have an alkalosis. Would a CO2 of 36 cause an alkalosis? Well, no, it's normal. Would a bicarb of 40 cause an alkalosis? Yes. So we have a metabolic alkalosis. Okay? Pretty straightforward. Now here's where it might get a little tricky. Okay, so let's say we have a pH of 7.28. Okay, let's say we have a CO2 of 30, and we have a bicarb of 18. Okay, so let's map this out. So pH of 7.28, well, we know it's less than 7.35, we have an acidosis. Where's our CO2? Where CO2 is less than 35, it's 30, so it's here on the alkalotic side. And then what about our bicarb? Where our bicarb is less than 22, it's on our acidotic side. Okay, what's going on here? So we have acidosis. We ask ourselves, would a CO2 of 30 cause an acidosis? No, because this is on the alkalotic side. Would a bicarb of 18 cause an acidosis? Well, yes. If you want to look at the map we drew out, well, they're on the same side, but a low bicarb, so low base, that's causing acidosis. So this is representing a metabolic acidosis. So we haven't talked about compensation. So after we've just figured out, do we have an acidosis or alkalosis? And then now we should consider what our primary problem is. Before we just said, oh, it's respiratory or metabolic. Now, what's our primary problem? Okay, because in here we're going to have compensation. So our primary problem is going to be metabolic acidosis, right? Because a low bicarb is going to jive with a low pH, right? So that's a metabolic acidosis. Now, what about our CO2? So how do we know we have compensation? So once we've selected our primary problem, we look to the other number. So in this case, the other number, is the way I put it, is the CO2. Because the bicarb is our primary problem. So CO2 is the other number. If that's normal, there's no compensation. So if the CO2 is normal, there's no compensation. We've already seen that. Oops, let's get that out of the way, right? So if the CO2 was 36, it'd be a metabolic acidosis with no compensation. But it's out of range. So if the other number is out of range, it can mean two things, right? If it's out of range in the opposite direction, which in this case it is, right? A low CO2 represents an alkalosis, we have compensation, okay? So the respiratory pathway is compensating, okay? So it's compensating by what? If our CO2 is going down, well, technically we're hyperventilating, we're blowing off more CO2, so our CO2 levels go down in the body, and that's going to compensate for the metabolic acidosis. An example would be, let's say this is diabetic ketoacidosis. You have a patient in DKA, they have a low pH, low bicarb, and they're hyperventilating. So Kussmaul breathing, they're breathing off more CO2, okay? And that's going to affect the acid-base balance, because acid-base balance is just your acid and your base and how they're balancing out. You're like, that's great hand motions. So in this case, there is compensation, okay? So we have compensation, that's great. It's moving in the opposite direction, okay? Well, and this would be considered partially compensated, okay? There's two kinds of compensation. So partial compensation would be, okay, the other number's out of range in the opposing direction, great. So there's compensation. So metabolic acidosis with respiratory compensation. But the next question after, is there compensation? Is this partial compensation or full compensation? In this case, we have a partial compensation. Why? We have a metabolic acidosis. This patient's breathing off CO2, which can bring the pH up. We're trying to bring that pH up back to into the range, right, back to homeostasis, and it's not quite there. It's 7.28. It's still out of range. So we've compensated, let's say, we're trying to bring this pH up, but it's not normal. We're not back in homeostasis, so this is partial compensation. If we had the same problem and we erase this 7.28, let's say our pH is 7.37, Well, this would be fully compensated because we pulled the pH up into normal range, okay? But let's take a step back. So let's do another partial compensation problem. So pH, let's say it's 7.48. Okay. Let's say our CO2 is 28. And let's say our bicarb is going to be 16. All right, so what does that give us? How do we know? So 7.48, so alkalotic, run this side. CO2 of 28, well, it's below 35, so it's on the alkalotic side. Bicarb of 16, well, that's going to be less than 22, acidotic side. Okay? So both these numbers are out of range, but our pH is alkalotic, right? So we have an alkalosis, so which of these two numbers is going to be our primary problem, which is matching up? Well, they're both on the alkalotic side if you draw this graph out, so we have a respiratory alkalosis, our primary problem. Now, do we have compensation? We look at the other number. The other number here is bicarb, representing the metabolic pathway. Is that in range? It's out of range. Okay, it's out of range in the opposite direction. It's on the acidotic side. So there is compensation to the metabolic pathway. Is that compensation partial or full? It's partial because the pH is still out of range. It's not, we haven't brought it down back into normal range, so it's partial compensation. Okay, so that's another example of a partially compensated respiratory alkalosis, so another partial compensation problem. All right, so let's talk about full compensation. This is probably the trickiest part. Okay, so let's say our pH is, we keep going back and forth. So our pH is 7.31. Let's say our CO2 is 60. And let's say our bicarb is 40. Why screw that up? Let's say our pH is, okay, let's say our pH is 7.3, wow, 7.36 again, okay? So our pH is normal, 7.36. Our CO2 is 60, so it's greater than 45, it's acidotic. And then our bicarb is 40, so it's 40, so it's very high. Okay, so now what? We have a normal pH. A little side tip. If you have a normal pH, you're reading an ABG, the first thing you see is a normal pH. A normal pH means one of two things. One, you have a normal ABG, right? So this is normal. The first thing you should look at is your CO2 and your bicarb. If they're within normal limits, right? If your CO2 is 40 and your bicarb is 24, well, it's a normal ABG. There's no acid-base imbalance. You're done. Easy. The other scenario with a normal pH is you have a fully compensated ABG. So as soon as you see a normal pH, you look at your other numbers, and if they're out of range, you automatically know you have a fully compensated ABG, right? Okay, so you have an out of range CO2, an out of range bicarb, and a normal pH. So here's the tricky part. Well, one's on the acidotic side, one's on the alkalotic side. But which one's our primary problem? Right? If our pH isn't on an acidotic or alkalotic side of the spectrum, well, what's our primary problem and what's our compensation, right? So what's the primary problem? What's the compensation? This is how we do it. So 7.35 is 7.45, right? Well, our pH is closer to the acidotic side, right? If we're closer to 7.35, we're considering this an acidosis. If we're closer to 7.45, we're considering this an alkalosis. 7.36 is closer to acidosis. So we're going to pick our primary problem as respiratory acidosis. Okay, respiratory acidosis, and our compensation is going to be metabolic alkalosis. Okay, so why does that make sense? So if we're compensating on our acid-base balance in our body, we're not going to overcompensate, right? We're going to partially compensate. Let's say we have respiratory acidosis, we pull the pH up, it's 7.32. it's partially compensated, right? We're trying to get it up there. Or if we do fully compensate, we get within range, but we're not going to overcompensate and pull the pH up towards the alkalonic side. That's not going to happen. So if we even do get full compensation, we're not going to overcompensate. And that's why this works. Okay? This on the acidotic side, we're not going to overcompensate, so we're going to pick respiratory acidosis as our primary problem. And then we have full compensation, obviously, and our compensation is metabolic alkalosis. Okay? If I make one little change to this problem, I change this pH from 7.36, let's say it's 7.41. Well, guess what? Now it's on the alkalotic side, okay? So it's not a respiratory acidosis that we overly compensate for. No, that's not how we do these basic problems. It's now on the alkalotic side. So now our primary problem is metabolic alkalosis, and our compensation is respiratory acidosis. And this is where it gets tricky. It might take you a minute to wrap your head around it, okay? So just think, if you have a fully compensated ABG, you have to say, what is my primary problem? Like, what's wrong with the patient, and what's my compensation, right? So if my pH is down here again, I have respiratory acidosis, right? For whatever reason, COPD, exacerbation, pneumonia, whatever, you're retaining CO2 levels are going up, your pH is going down, you have acidosis. Well, you can compensate that through metabolic pathways, through buffering and through the kidneys, right? The kidneys can excrete more hydrogen ions and retain more bicarb, so more secretion of hydrogen, more retention or reabsorption of bicarb, and we can increase our bicarb levels, which can help pull that pH up into range, okay? So that's what's happening. But again, depending where this falls in that spectrum will determine if it's respiratory acidosis or metabolic alkalosis. So what's the actual problem with the patient, and what's the compensation? If it's 7.4, and people always ask me this, if it's 7.4, well, I would never ask you that in an exam. But in that case, you have to look at the whole clinical picture of the patient, right? You're not just going to draw an ABG and that's it. You have other lab values, you have other imaging testing, you have the patient's history. There's a lot more information to go on. You have your physical exam to base this on, okay? You can't just base it on just an ABG, okay? But for board exam questions, questions on my exams, I wouldn't put 7.4 because that's just not nice, okay? Last point, and then we'll stop. So what if you have this problem? And this is where people can get tripped up. Okay, so let's say you have a pH of 7.52, you have a CO2 of 25, and you have a bicarb of 28. Okay, so 7.452 up here. CO2 of 25, it's going to be here. Bicarb of 28, that's up here. So this is where you can get tripped up. So you can say, oh, okay, I have an alkalosis. You look at your CO2 next. Oh, it's a respiratory alkalosis. And my other number's out of range, so there's compensation to the metabolic pathway. This is a respiratory alkalosis with partial compensation. No, don't forget, the other number's out of range, but it has to be in the opposite direction. So my bicarb is low, be compensated, but it's on the alkalotic side. All three of these are on the alkalotic side. So what do we call that? This is a combined alkalosis, okay? So there's no compensation. You can't compensate a respiratory alkalosis by raising my bicarb because my bicarb's a base, okay? That wouldn't work. And so the flip side, that's a combined alkalosis, so combined acidosis. So let's say your pH is 7.3. Let's say your CO2 is 50. Let's say your bicarb is 14. Well, same thing. This represents a respiratory acidosis. This represents a metabolic acidosis. So what does this mean? The patient has two things going on. They have COPD, or they're retaining CO2, and they have lactic acidosis, or another form of metabolic acidosis, right? Or they're retaining hydrogen ions for whatever. So they have two different problems going on. So you have two pathologies you're dealing with that are both directed towards acidosis. So this is a combined acidosis. This would be a combined acidosis. So combined alkalosis, combined acidosis. So don't get tripped up and say, well, one number's out of range, or one, you pick one because you're rushing, and you forget the other one's just out of range, but you gotta think, well, which direction it is. The last tip I'll give you, if you're struggling, always just look. You can break this down, and if you just get these two out of the way. So get the pH out of the way, get one of these out of the way, look at just this alone. So if I give you any number here, if I say a CO2 of 50, that represents respiratory acidosis. If I have a CO2 of 32, that represents respiratory alkalosis. So just looking at this, so whether this is compensation or primary problem, right, you can look at that and just know what that is if you just isolate it. Same thing with the bicarb. Just know, if you memorize your values, you know you can spit out, hey, bicarb's 18. Okay, it represents acidosis. Bicarb's 28, alkalosis, right? Bicarb's 25, it's normal. So you can isolate those as well, okay? But it'll take some time and some practice. But once you get it down, you're gonna be pretty good shape.